Hi, welcome back everyone. This is Dr. Jenkins. Here we are talking about blood flow through the heart. Now, with Dr. Kelly's lecture, I'm sure she's going to go through this, but I think I said this in a previous video. If I haven't, it's about time I say it. The more we can go through things, the better. So repetition. Listen to what Dr. Kelly has to say. Listen to what I have to say. And between the two of us and studying and asking questions when you have them, you should be able to get this down. So, blood flow through the heart. Now for this lab, see here I'm getting excited already. Delete that, okay. For this lab, you're going to have to know the anatomy of the heart. I've put pictures online. I put a list of structures that you need to know. You can totally do that. So don't be intimidated by the heart. Learn the chambers, learn the valves, learn the vessels, and then there's a couple other structures. At the same time as you're learning the anatomy, it is so helpful to look at the blood flow through the heart. In other words, we're putting the structures of the heart in order. So to understand the heart, not only do you have to know the structures, the chambers, the valves, the vessels, etc., but you really have to know how the blood moves through it. So let's just cover some basics. I know Dr. Kelly has covered it, but again, the more we can go through it, the better. When you see a red vessel, we know that a red vessel means it's an artery. An artery is carrying blood that is oxygenated. That's what gives it its red color. And an artery means that the blood is moving away from the heart. Okay, so in this picture here we can see, let me change color just so you can actually see what I'm talking about. Let's go to black. We could do white actually. This is the aorta, right? It's the aorta because it's red in color. And that tells us that the blood moving through it is oxygenated. And because it's red, we know the direction of flow. An artery carries blood away from the heart. Versus vessels that you see that are blue are considered to be veins. You know this, right? Veins carry blood that is deoxygenated, which means the blood does not carry oxygen. The red blood cells don't have oxygen yet because the blood hasn't yet gotten to the lungs to pick up oxygen. And veins carry blood towards the heart. So if I look at this picture, let's go back to a color we're going to be able to see. This here is the superior vena cava. It's blue, it's a vein, so it's carrying blood that is deoxygenated. And I know because it's a vein, the blood is going to be traveling towards the heart. Now, as is the case in the body, sometimes there are some exceptions. And the exceptions to these rules, there's only 2 of them in the whole entire body. Out of all of our vessels, all our arteries and veins and capillaries, there is only 2 exceptions to these rules. And those exceptions would be the pulmonary veins and the pulmonary arteries. This is going to become clearer, meaning why there is this exception. It's going to become clear once we begin going through the blood flow through the heart. But I just want to introduce that to you. Only case in the body where an artery is going to be blue. So it's the only artery that is blue, which tells us in pictures that it is carrying blood that is deoxygenated. However, it's still an artery because it's carrying blood away from the heart. So here's the exception. The pulmonary artery is carrying blood that is deoxygenated, but it's still an artery because it's carrying blood away from the heart. On the other side, we have the right pulmonary veins. They're shown here as red. So the right pulmonary veins are red, the only veins in the body that are red. And the red color tells us that it's carrying blood that is oxygenated. But it's still a vein in that it's carrying blood towards the heart. Oh, I had those arrows wrong. See, it's a good thing I checked myself. It's carrying blood towards the heart, so it's going this way. My bad. So I would first know these rules. Blue equals veins. Deoxygenated blood, blood is moving towards the heart. Red means artery. Blood is oxygenated and blood is moving away from the heart. And there are only two exceptions, pulmonary artery and pulmonary veins. And the only way that they're different is the color. The pulmonary arteries are still carrying blood away from the heart. So that's really the same. The only difference is that the pulmonary artery is blue because it's deoxygenated. The pulmonary veins are still carrying blood towards the heart as veins, so that's really the same. But the only difference is that the pulmonary veins are oxygenated, carrying oxygenated blood, so they're red. All right, now I posted this PowerPoint on Blackboard for you. Some people like to learn the order of structures the blood goes through by a list, so we can see the right side of the heart, the pulmonary circuit. I've given you a list of structures in order. Blood moves from the vena cava to the right atrium, through the tricuspid valve, into the right ventricle, and so forth. And then I've given you the remaining list, the systemic circuit or left side of the heart. That may work for you. I am more visual, so this tends to be how I'm going to show you now, tends to be a way that works for me. On the PowerPoint, on Blackboard, it shows you this, the way that it is, but also at the end, you see it all put together. And on the PowerPoint, you'll be able to click the PowerPoint slide one at a time, and each step will appear. On this program that I'm using here, I can't do it step by step. That's why I have separate slides. Okay, so let's look at how blood moves through the heart. What we're going to see is that we're starting with these arrows that are blue. And why are these arrows blue? Because we're talking about veins. So on here, most of the veins, with the exception of the pulmonary veins, are blue. So that's indicating to us that this blood returning to the heart from the body is returning to the heart from the body. The blood is deoxygenated, but that makes sense. The blood is coming back to the heart. And the reason it's deoxygenated is because the blood delivered the oxygen to the cells, and now it's on its way back. So it's already delivered the oxygen to the cells of your arms and your legs and your gut. But now we need to bring the blood back to the heart to get it reoxygenated, but it's not yet oxygenated. Blood from the upper body is going to return back into the right atrium via the superior vena cava. Blood from the lower body is going to return back into the heart via the inferior vena cava. And of course, all of this deoxygenated venous blood is going to dump into the right atrium. Now, when the atrial walls contract, it's going to push the blood from the right atrium through the tricuspid valve into the right ventricle. Okay, so when the right atrial wall contracts, it's going to push blood through the tricuspid valve, shown here as 3 cusps. It's going to go through the tricuspid valve into the right ventricle. Excellent. Repetition, folks. Just keep going through this. Now, when the blood gets to the right ventricle, it's then going to travel, and this arrow is the wrong color. It showed up this way. I don't know why, but this arrow should be blue. So let me fix that for you. This arrow is going to be blue because the blood is not yet oxygenated. Okay, good. So when the right ventricular wall contracts, it's going to push the blood up this direction through the pulmonary semilunar valve into the pulmonary trunk. And the pulmonary trunk is going to split into the left pulmonary artery and the right pulmonary artery. Let me say that again. So when the right ventricular wall contracts, it's going to push the blood out of the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. And then the pulmonary trunk splits off into a left pulmonary artery and a right pulmonary artery. And where is that blood going to go? To the lungs. Here we see why the pulmonary arteries are blue. These are still considered arteries because the blood is going away from the heart. So they're still considered arteries because the blood is moving away from the heart. But this is the only case in the body where an artery carries blood that is deoxygenated. And the reason why the pulmonary arteries carry blood that is deoxygenated is because that blood hasn't yet gotten to the lungs to pick up oxygen. Make sure also that we remember that this is the right side of the heart and this is the left side of the heart, because we label things as what they would be on the person, not how we view them looking at them. All right, so that is the pulmonary circuit, or the activity of the right side of the heart. Blood returns to the heart via the superior and inferior vena cava into the right atrium. This blood is deoxygenated, shown as blue. Then when the right atrial walls contract, it's going to push the blood through the tricuspid valve into the right ventricle. Then, when the right ventricular wall contracts, it's going to push the blood through the pulmonary semilunar valve into the pulmonary trunk, out the right and left pulmonary arteries to the lungs. I'll make a point while I'm here. Let me change color. Let's go with green. The reason when the right ventricular walls contract, the reason that the blood goes in this direction is because the tricuspid valve is closed. I know in the previous step, blood did move from the right atrium into the right ventricle. But immediately after the blood moves through the right atrium to the right ventricle, that valve closes. Which means that when the right ventricle wall contracts, the blood has nowhere else to go but up here. It can try and go back this way, but the valve is closed. So it's not that the blood necessarily knows where to go. It's just that because the tricuspid valve closed, the only way that the blood has to move through something open is through the pulmonary semilunar valve. All right, now let's do the left side of the heart, or the systemic system. So now we're going to have blood returning from the lungs. But now these arrows, they look kind of whitish, but they're kind of pink. Now the blood is returning oxygenated because it just came from the lungs where the blood picked up oxygen. The blood is going to return to the lungs via the pulmonary veins into the left atrium. These are the pulmonary veins. They're considered veins because blood is moving towards the heart, which is what all the veins do, carry blood towards the heart. But this is the only exception where a vein is carrying blood that is oxygenated. And the reason why is because this blood coming back to the heart just so happens to be coming from the lungs where it picked up oxygen. Cool. So blood returns from the lungs back to the heart into the left atrium via the pulmonary veins. Then, when the left atrial wall contracts, the blood is going to move through the bicuspid or mitral valve into the left ventricle. So when the left atrial walls contract, the blood is going to move through an open bicuspid or mitral valve into the left ventricle. Lastly, when the left ventricular walls contract, the bicuspid or mitral valve will be closed. So the only route that this blood has when the left ventricular walls contract is the blood is going to go through an open aortic semilunar valve, which is underneath here. This picture, it's hard to see the aortic semilunar valve. It's actually underneath the pulmonary semilunar valve. So what we see here is the pulmonary semilunar valve, but underneath it is the aortic semilunar valve. So when the left ventricular walls contract, it's going to push blood through the aortic semilunar valve into the aorta, and then that aorta is going to carry the blood out to the body. It's going to go down to the lower part of the body. The blood's going to go up towards the arms and the head. Okay, so the systemic side, the left side of the heart, we had blood returning from the pulmonary veins into the left atrium. Then when the left atrial wall contracted, it pushed blood into the left ventricle. And then when the left ventricular wall contracts, it pushes blood through the aortic semilunar valve into the aorta and out to the body. Here it is all together. One last point I'd like to make. Now, even though we went through it, right side, and then the left side, it is true that both sides of the heart are contracting at the same time. So in reality, the right atrial wall that pushes blood from the right atrium into the right ventricle, when the right atrial wall is contracting, the left atrial wall is contracting also. I broke it down just so you could better understand how like a single drop of blood is traced through the heart. But no, in actuality, both sides are working at the same time. Okay? Now, last thing I want to do is I want to go through this all together. And I'll say it all together for you. Are you ready? Let me get my pen because I like to work with the pen. I'll go with the black color. Maybe I'll go with, I like the green. Let's go with the green. Okay, so from the beginning, right? Blood is going to return from the body to the heart into the right atrium from the superior vena cava, and blood is going to return from the body via the inferior vena cava into the right atrium. This blood is deoxygenated. When the right atrial wall contracts, it's going to push blood through the tricuspid valve into the right ventricle. When the right ventricular wall contracts, it's going to push blood through the pulmonary semilunar valve into the pulmonary trunk, and then out the left pulmonary artery and right pulmonary artery to the lungs, where the blood picks up oxygen. Then, now the blood is oxygenated, and it's going to return to the heart via the pulmonary veins into the left atrium. When the left atrial wall contracts, it's going to push blood through the open bicuspid or mitral valve into the left ventricle. Lastly, when the left ventricular wall contracts, it's going to push blood through an open aortic semilunar valve underneath here into the aorta. And then the blood is going to be pumped out to the body, through the lower body and then the upper body and the arms. Excellent. You have all you need. Be prepared for questions on your lab quiz where I ask you to fill in the blank. For example, if it says left atrium, blank, left ventricle, you know the answer would be bicuspid or mitral valve. All right, good luck, everyone. I'm here if you have questions.